Francisco Department of Public Health says that overdose deaths are on the decline. Last month, 66 people died from a drug overdose compared to 73 deaths in May of last year. The department credits a new night navigator program that sends health experts out late at night. KRON 4's Rob Nesbitt joins us now live in the studio with more on the work of a night navigator. Rob.
Doctors with the Department of Health talked today about buprenorphine, microdosing, and what they consider to be an innovative approach to treating fentanyl addiction. San Francisco's Night Navigator program has been in the works since March. Every night from 8 p.m. to midnight in the Tenderloin, health experts connect people struggling with addiction to treatment. Director of Behavioral Health and Mental Health in San Francisco, Dr. Hillary Cunnins, says microdosing buprenorphine has been one of the most successful forms of treatment.
Buprenorphine is one of the two most highly effective medications and reduces the risk of overdose death by approximately 50%.
The other medication is methadone, but there are strict regulations on who can prescribe that medication. Dr. Joanna Eveland is the chief medical officer for people experiencing homelessness and for people who use drugs. She says that buprenorphine helps decrease the withdrawal symptoms that someone struggling with addiction experiences when they stop using harmful drugs.
We know buprenorphine is a highly effective medication for controlling cravings. My patients who are taking buprenorphine report that they feel normal and stable. They can go back to work. They can take care of their families.
The Night Navigator program does not just work to provide drug treatment in the Tenderloin. Dr. Eveland is oftentimes on the other end of the phone during telehealth calls made late at night, working to remove the barriers that someone struggling with addiction might face.
They need an ID, if they need help getting their insurance updated, if they need transportation to the pharmacy.
As well as offering hotel rooms or access to a shelter bed for someone experiencing homelessness at the same time as an addiction to fentanyl. In addition to the Night Navigator program, the city also provides treatment with buprenorphine at primary care clinics, specialty behavioral health clinics, and permanent supportive housing sites, homeless shelters, and navigation sites. Reporting in studio, I'm Rob Nesbitt, KRON 4 News.
Thank you, Rob.